So that's why I often think of that immediately when we're talking about insulin resistance. But it's possible for people to be insulin resistant to varying degrees for quite some time before their blood glucose ever starts to rise and they receive a diagnosis of type 2 diabetes. And the other thing is that we often associate type 2 diabetes with metabolic syndrome, where somebody might be very overweight and have high blood pressure. But actually, it's possible to be insulin resistant and have high levels of insulin, even if you're thin on the outside. And sometimes that's referred to as TOFI, thin on the outside, fat on the inside. So yeah, there's some really interesting research by Dr. Cynthia Culkin that showed in people with symptoms of severe mental disorder who had maybe once responded to treatment at some time in the past, but over time their symptoms had become more persistent and less responsive to standard medications. They were able to show that from the cohort of people they tested, that all of the people with insulin resistance had problems with their blood-brain barrier, which would be the main protective mechanism for the brain. And once they were able to reverse the insulin resistance, these people saw improvements in their mental health symptoms and started responding to standard medications again. So really, really interesting connections there.
Yeah, it is super interesting. And I think, we could go down a rabbit hole with this in regards to why, ketones can help with this and so on.